Dr. Chris Arnold here from Live Well Chiropractic. Another big myth that centers around heart disease is, first of all, blood pressure. A lot of people, personally feel, are over-medicated and actually have too low a blood pressure. Yes, too low a blood pressure. We see all kinds of people coming in where they're just really tired and fatigued. They get dizzy standing up. They just kind of lose the juice in their body, especially as you age. And a lot of people, we found out, is their blood pressure. Ask them, what is their normal blood pressure? Well, it's about 120 over 70. I was like, do you realize that that actually might be too low for your body? It's about 5 or 6 years ago, the FDA came out and they actually raised what they classify high blood pressure anymore. Most people are unaware of it. It actually recommends now anything over 140 over 90, that's the cutoff point. Anything above that is actually high blood pressure. So what we know and understand as you age, your blood vessels lose the elasticity. It doesn't kind of spring as much as they should. So to make up for that, your heart actually pumps a little harder to actually keep the blood circulating. So we know as you get a little bit older, your blood pressure should slowly rise with age and cause you to actually have increased blood pressure. You need a lot of blood pressure to what? To reach this thing between your ears called your brain. If you have too low blood pressure, that's where you feel the fatigue, the tiredness, the foggy or the cloudy feelings and the thoughts and stuff. So we see a lot of people, like I said, that are on high blood pressure medicine that probably does not need to be. And another factor that goes into this is most people go to the doctor's office, they're already excited already. So the blood pressure, which is maybe low, now all of a sudden just slightly elevates, and the doctor diagnoses you on the 5 minutes you're in the table with high blood pressure, and you might have normal blood pressure. So a lot of people we find are over-medicated. So it's a good thing to actually take your own blood pressure, measure it over time, and if it's under this 140 over 90, which is the FDA recommendations now, you should not be taking medications. You're actually over-medicating your body. So come to our heart health class. We're going to discuss a lot of other myths that are out there about heart disease, how a lot of people are probably taking medication they don't need to be. The class is going to be on Thursday, June 27th. At 6:30 in the evening right here at our office, and it is open to the public, so you can bring any friends and family members. The last thing I have up here is we're actually going to be talking about healthy things you can include in your diet that will help your body and your brain, and especially your heart. One of them is going to be coconut, one is going to be some other healthy fats. Yes, fats are healthy and one of the best things you can eat for your brain and for your heart. So we're going to discuss how this low-fat myth has been debunked probably 10 years ago. We found out that it's not been true anymore. So let's learn and actually get some healthy things to keep you preventing from heart disease and also make you feel good in the process so you're not, again, drugged up with all these side effects. So check out our class coming up Thursday, June 27th at 6:30.